It could happen anywhere, at any time, to anybody. It is sudden cardiac arrest. Sudden cardiac arrest, SCA, is a leading cause of death in many countries throughout the world. Currently, fewer than 5% of victims of sudden cardiac arrest survive. But there is a tool you can use that greatly increases the SCA victim's chance of survival. The HeartStart Defibrillator. Small, automated defibrillators are already being used by a variety of trained responders to treat sudden cardiac arrest caused by ventricular fibrillation. Ventricular fibrillation is a chaotic quivering of the heart muscle and can occur for a number of reasons. During ventricular fibrillation, the heart cannot pump blood effectively. The patient becomes unconscious, stops breathing, and has no pulse. The only effective treatment for ventricular fibrillation is defibrillation. Defibrillation is the delivery of an electric shock across the heart using special adhesive pads applied to the patient's bare chest. When defibrillation is performed within the first few minutes of cardiac arrest, it often stops ventricular fibrillation, allowing the heart to resume a regular rhythm and pumping action. For each minute that defibrillation is delayed, the victim's chance of survival decreases by about 10%. Early defibrillation greatly increases a sudden cardiac arrest victim's chance for survival. The HeartStart Defibrillator from Philips makes it possible for a broad range of rescuers to respond to sudden cardiac arrest. It is designed to be fast to learn and easy to use for the ordinary person in the extraordinary moment. This video provides the basic information you need to operate and maintain the HeartStart Defibrillator from Philips. A HeartStart Defibrillator user should also have training in cardiopulmonary resuscitation, CPR, and defibrillator use, or otherwise be authorized by a physician. First, let's take a quick look at the layout of the HeartStart Defibrillator. Pulling this green handle turns on the defibrillator and begins the voice instructions.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
The handle is part of a removable hard protective cover on the defibrillation pads cartridge. The HeartStart uses only HeartStart Smart pads. They are available in adult and infant child cartridges. As we'll see later, the cartridge contains 2 adhesive pads on a common liner. This green ready light should be blinking as long as a battery is installed in the defibrillator. It means that the HeartStart has passed its last self-test and is therefore ready for use. Beneath it is a green on-off button, which provides another way to turn on the defibrillator, and when pressed and held down is used to turn off the defibrillator. Below the on-off button is a blue button with an I on it. This is the information button, or I button. It comes on when the HeartStart can provide information, such as CPR coaching, if you press the button. Next is a triangle-shaped caution light. It comes on when the defibrillator is analyzing the heart rhythm or delivering a shock, as a reminder that you should not be touching the patient at these times. The orange button with a lightning bolt symbol is the shock button. If a shock is advised, the shock button will start flashing, and the HeartStart will instruct you to press it to deliver the shock.
Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered.
The battery is located on the back surface of the defibrillator. It snaps into place easily. As long as a battery is in place, the green ready light should be blinking to show that the HeartStart is ready for use. Detailed information about all the features of the HeartStart Defibrillator is available in the instructions for use provided with the defibrillator. Now, let's run through the sequence for using the HeartStart defibrillator.
Did you work out this morning?
No, I wasn't feeling too well this morning. Morning, Quentin.
Good morning.
How did Barbara do last night?
She won the game.
Terrific.
Armando? Armando, are you all right? Armando! Armando, it's Marina. Armando! Quentin, come quick. Armando has fallen. He's unresponsive. Call Katie and tell her to call 911.
Okay. Katie, this is Quentin. I'm in Armando's office. He's collapsed and he's not responding. I need you to call 911. Okay, thank you.
He's not breathing. Get the defibrillator. It's on the wall by my office.
Okay.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
This is a defibrillator. I'm going to go down, meet the ambulance, bring him up.
Okay, thanks.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. No one should touch the patient. Analyzing. Shock not advised. Be sure emergency medical services
Armando?
have been called. It is
Armando,
safe
are
to
you
touch
okay?
the patient.
Okay, just relax. Okay?
He's right here.
It's gonna be all right.
Hi, can you tell me what happened?
Yeah, we walked in here and he just dropped to his knees and then he just fell down. He was unresponsive. There's more information if you press the blue button.
Okay, great. Let's do that.
Okay.
One shock, 7 minutes.
So did you do CPR?
Yeah, I did CPR before I got the defibrillator.
Okay, good. Good job.
Before using the HeartStart defibrillator, verify that the patient is in cardiac arrest by establishing that the patient is unresponsive and is not breathing normally. Assess responsiveness. If the patient is unresponsive, immediately call the emergency medical services number for your area. Assess breathing. Open the airway and check for breathing. Usually, a person in sudden cardiac arrest is not breathing at all, but sometimes abnormal, ragged breaths are seen for a short time after collapse. If the patient is not breathing, give 2 rescue breaths. Then quickly apply the HeartStart defibrillator. If the defibrillator is not immediately available, perform CPR until someone can bring it to you. Using the HeartStart defibrillator is very easy. As soon as it is available, place the defibrillator on the same side of the patient that you are on, near the patient's head. If the HeartStart is stored in its optional case, unzip the case. Pull the green handle to remove the hard cover of the pad's cartridge. This will automatically turn on the defibrillator. You can also turn it on by pressing the green on-off button. The HeartStart will start giving you clear, calm instructions that keeps pace with you as each action is completed. Remove the clothing from the patient's chest, cutting it off if necessary. Then peel the film seal from the cartridge and take out the pads. Next, you must place the pads. Peel one pad from the liner and place it on the patient's bare chest, following the illustration on the pad. It does not matter which pad is placed first. As soon as the first pad has been removed from the liner, the HeartStart will remind you to place it on the patient, as shown in the illustration on the pad. Then peel off the second pad and place it. Be sure the pads have been removed from the liner before placing them. If the defibrillator senses any problem with the quality of pad's contact, it will instruct you to correct the situation. As soon as the pads are properly attached, the HeartStart automatically begins analyzing the patient's heart rhythm, or ECG. Rescuers should not touch the patient while the defibrillator is analyzing. The triangular caution light will turn on and start flashing as a reminder. The HeartStart will tell you if a shock is advised. Then, press the shock button. If a shock is advised, the caution light will stop flashing and remain on, and the orange shock button will start flashing. Before pressing the button to deliver the shock, you must make certain that everyone is clear of the patient. Check visually that no one is touching the patient. Instruct everyone to stay clear of the patient. Press the orange shock button to deliver the shock. The shock will not be delivered unless you press the button. After delivering the shock, the defibrillator immediately reanalyzes the heart rhythm. Do not touch the patient until the defibrillator tells you it is safe. It will advise you if any additional shocks are necessary. If no shock is advised after rhythm analysis or upon completion of a shock series, the HeartStart will remind you to call emergency medical services in case you have not yet done so, and then instruct you to assess the patient and begin CPR if needed. The I button will start flashing and continue for 30 seconds. If you press the I button while it is flashing, the HeartStart will provide voice instructions to coach you in basic CPR and provide a rhythm for compressions. If the infant child smart pads cartridge is installed, the defibrillator will provide guidance for performing CPR on a child. Immediately check the patient's airway, breathing, and circulation. If the patient is breathing, CPR is not needed. If breathing is absent, provide CPR and basic life support as needed. Leave the pads attached to the patient and the defibrillator turned on in case additional shocks are needed. In all cases, continue to follow the HeartStart defibrillator's instructions until the emergency team arrives. The HeartStart defibrillator can safely deliver defibrillation shocks to infants and young children up to 8 years of age or 55 pounds using the HeartStart Infant Child Smart Pads. The Infant Child Smart Pads cartridge is easily identified by the teddy bear on the packaging. If you need to use the HeartStart defibrillator on an infant or child and have an Infant Child Smart Pads cartridge available, remove the Adult Smart Pads cartridge from the device by sliding the latch at the top and lifting out the cartridge. Remove the Infant Child cartridge from its packaging and install it in the defibrillator. Be sure to press the cartridge down until it latches into place. Then pull the green handle to begin the rescue. Because of the small chest area of these young patients, the HeartStart Infant Child Smart Pads are placed differently from adult defibrillation pads. After removing all clothing from the torso, place one pad on the patient's bare chest, between the nipples, exactly as illustrated on the pad. Roll the patient onto her side and place the second pad on the back, between the shoulder blades, as illustrated on the pad. As it does with adult pads, the HeartStart defibrillator immediately begins analyzing the heart rhythm, and if needed, will deliver a shock at a lower energy, appropriate for infants and young children. Sometimes it is difficult to determine a child's exact age or weight. If a child appears to be older than 8 or larger than 55 pounds, use the Adult Smart Pads cartridge. Do not delay treatment to determine the child's exact age or weight. All persons trained to use the HeartStart defibrillator on pediatric patients should also be trained to provide pediatric CPR and other basic life support. To summarize, after confirming that the patient is in cardiac arrest, pull the green handle on the pad's cartridge to turn on the HeartStart. Peel off the film seal and pull the yellow tab to remove the pads from the cartridge. Remove one pad from the yellow liner and apply it exactly as illustrated on the pad. Then repeat with the second pad. Do not touch the patient while the defibrillator analyzes the heart rhythm. If a shock is advised, clear the patient and press the shock button. Continue to follow the voice instructions until the patient can be delivered to the next level of care, or as your protocols indicate. If the HeartStart defibrillator detects a problem while you are using it, it will provide a voice instruction to guide you in correcting the problem. If this happens, stay calm and follow the defibrillator's instructions. For example, if the HeartStart tells you that the pads are not making good contact,
Make sure that the yellow plastic liner is completely removed from both pads. Place pad exactly as shown in the picture. Pads must not be touching clothing or each other.
you should press the pads firmly onto the patient's bare skin. Check that there is no obvious damage to the pads or the cable. If the instruction continues, remove the pads from the patient. Shave the chest if there is excessive hair, preventing good contact between the pads and the skin. Dry the skin if it is wet. Attempt to reapply the pads. If the prompt continues, remove the pads. Then remove the used pads cartridge by sliding the latch on the top of the device and lifting out the cartridge. The HeartStart will tell you to install a new pads cartridge.
Insert pads cartridge.
Place a new cartridge into the cartridge compartment. Be sure to press the cartridge down until it latches into place. As soon as you pull the cartridge handle to remove the hard cover, the HeartStart resumes its voice instructions for the rescue. Refer to the instructions for use provided with the HeartStart defibrillator for detailed troubleshooting information. There are a few safety issues and other considerations to keep in mind when using the HeartStart defibrillator. These are discussed in detail in the instructions for use. Do not use the HeartStart on a patient who is responsive or breathing normally. If you are in doubt, apply the defibrillator. Attach the defibrillation pads firmly to the patient's bare skin. Loose pads may spark during a shock or may interfere with proper analysis of the patient's ECG. Do not touch the patient during rhythm analysis or when delivering a shock. Clear the patient visually and verbally and move supplemental oxygen and oxygen delivery devices away from the defibrillation pads. However, it is safe to use the HeartStart on someone who has an oxygen mask in place. It is safe to use the HeartStart on damp surfaces. However, the defibrillator should not be immersed. You can also use the HeartStart safely on a metal surface. Take care not to allow the pads to contact the metal surface directly. Patients who have implanted pacemakers or defibrillators can be treated with the HeartStart. The defibrillation pad should not be placed directly over an implanted device. A noticeable lump with a surgical scar should indicate its position. Peel away any medication patches from the patient's chest in the areas where the pads are to be placed. Then remove any remaining residue from the patient's skin. Local protocols for use of a defibrillator may vary. Be sure to review your organization's protocols before using the HeartStart defibrillator. Data management is simple with the HeartStart defibrillator. It automatically stores in internal memory the first 15 minutes of ECG and other detailed data from the last use. As long as the battery is not removed, the ECG data will be retained in the HeartStart's internal memory for 30 days. Other data is stored for up to 7 years. Using the HeartStart's infrared communication port, the data can be conveniently transferred to a personal computer running HeartStart Event Review data management software. This software allows storage and review of the recorded information and clears the defibrillator's memory for the next use. Instructions for transferring the data are provided with the HeartStart Event Review software. With its long-life battery, ready light, and automatic self-testing, including the smart pads, the HeartStart defibrillator is virtually maintenance-free. It has no user-serviceable parts and should always be returned to Philips Medical Systems for any service needs. Periodically and after each use of the HeartStart defibrillator, you should check all supplies and spares, such as smart pads cartridges and spare batteries, for any signs of damage. Check the use before and install before dates and replace any expired items. Also check to be sure that other equipment stored with the defibrillator, such as rescue breathing barriers, scissors, and a razor, are present and ready for use. The HeartStart defibrillator's battery is designed to provide a minimum of 90 shocks, or 3 hours of operating time. When stored in the recommended environmental conditions, a new battery will typically power the HeartStart in standby mode for at least 4 years. Standby means that the battery is installed, the green ready light is blinking, and the HeartStart is ready for use. To install the battery, remove it from its bag. Turn the HeartStart over. Insert the bottom of the battery into the bottom of the battery compartment. Then press the top of the battery into the compartment. The latch at the top of the battery should click into place. When the battery is inserted, the HeartStart automatically performs an extensive self-test and will continue to perform daily self-tests.
Self-test. In case of emergency, press the green on-off button.
As long as the ready light is blinking and the HeartStart is not chirping, you can be confident the HeartStart has passed its most recent self-test and is therefore ready for use. If the ready light is not on and the HeartStart is chirping, it needs attention. The blue I button will be flashing. Press the I button for more information and follow the defibrillator's instructions. For example, if battery power is low, the HeartStart will tell you to replace the battery.
Low battery. Insert fresh battery.
When you install a new battery, be sure to let the battery insertion self-test run through both its interactive and automatic parts. The interactive part of the battery insertion test consists of verifying correct operation of the device's orange shock button.
If the orange button is flashing, press it. Verified.
It is important to press the button when instructed to ensure the HeartStart defibrillator will be ready to use. If anything does not work as expected, make a note of the problem and contact Philips Medical Systems. When the interactive part of the self-test is complete, the defibrillator runs the automatic part of the self-test.
Testing.
Reports the test results.
Ready for use. In case of emergency, press the green on-off button.
And then turns off. Check the ready light to be sure it is blinking. If the ready light is not blinking and the HeartStart is chirping, remove the battery for at least 5 seconds, then reinstall it and repeat the self-test. If a second self-test fails, contact Philips Medical Systems for service. In the unlikely event that the defibrillator is needed for use while you are running the self-test, simply press the green on-off button or pull the pad's cartridge handle to stop the test and turn on the device for use. The HeartStart self-tests also include testing the SmartPads cartridge. If the self-test indicates that the cartridge is not suitable for use, the ready light will go off, the defibrillator will chirp, and the I button will flash. When you press the I button, the HeartStart will tell you to replace the pad's cartridge.
Pads not usable. Insert new pads cartridge.
The SmartPads are designed for one use only. After using the pads, you must replace the SmartPads cartridge. Installing and replacing the SmartPads cartridge is simple. The cartridge has a hard protective cover with a handle. Visible through the hard cover is a film seal imprinted with a diagram of proper placement of the pads. To install the cartridge, press the bottom end of the cartridge into the bottom of the cartridge compartment on the front of the HeartStart. Then press down the top of the cartridge until the latch clicks into place. To remove a pad's cartridge, slide the blue latch at the top of the HeartStart to the side to release the cartridge. Then remove the old cartridge and replace it with a new one. Do not remove the hard cover or film seal until ready to use the pads. Like any electronic device, the HeartStart defibrillator should be treated with reasonable care. It will operate in temperatures between 32 and 122 degrees Fahrenheit and should be stored at temperatures between 50 and 109 degrees Fahrenheit. Prolonged exposure to temperatures outside these recommended ranges may compromise shelf life and performance. If it becomes necessary to clean the device, follow the instructions provided in the instructions for use. The instructions for use also contain additional information on maintenance activities. The HeartStart defibrillator is designed to be fast to learn and easy to use. Just pull the handle and follow the instructions as it guides you through each step in treating a victim of sudden cardiac arrest. The HeartStart alerts you to any problems it detects and guides you in correcting them, so maintenance is simplified. Best of all, when you are trained in using the HeartStart defibrillator from Philips, it can mean the difference between life and death for victims of sudden cardiac arrest. The HeartStart defibrillator, power to save a life.